coming to you from General Delarey Hospital in Lichtenburg, the only hospital that is servicing people around the Lichtenburg area. As you would remember, that one of the hospitals in this area that used to work was Tusong Hospital, but was decommissioned in 2022, making residents rely on the specific hospital. This is the hospital that is now, we are told, and we have seen the impacts of the flooding that happened from yesterday, as we are experiencing the heavy downpours here in the Northwest Province, and of course across the country. We are told that a number of patients were moved to other health facilities to get health services, but just to get, to ascertain ourselves as to what happened and measures that will be taken, we'll talk to the MEC of the Department of Health here in the province, MEC Sello Lehari. Thank you so much for your time. You've been able to do walkabouts around the hospital, different wards. What is it that you have been able to ascertain yourself with as far as the condition of this hospital thus far?
Thank you very much. Indeed. I firstly met the management of this hospital, General Delarey, and also the team from the province. And also I did what we call walkabout here. I've seen with my own ears. Now the challenge here is not man-made. As they told me, the flooding happened yesterday around 10 o'clock. Many departments here, divisions were affected. But what is good about the management of this hospital, they removed those patients. There were 33 patients. The maternity ward was also affected. So those patients were removed and taken to the nearby hospitals. You have Mahikam Provincial Hospital, you have Ziras district hospitals, and also the clinics closer to these hospitals. We also go an extra mile by identifying 3 clinics in Lichtenburg hospitals, and we also dispatch our doctors and nurses in those clinics so that when patients come here, nurses who are here and the staff here, they refer them to those clinics so that they can get service.
What led to the flooding? Was it the issue of the drainage system, or if you may just tell us?
The briefing I got from the chief director for the province, as an expert, there's a challenge with the storm water system in the municipality. We are going to engage the municipality. We are fine with our own drainage system in the hospitals, but the challenge is the storm water system of the municipality. The water cannot be channeled very well, so that it must not affect the hospitals. Now, once we are done with the municipality and they are doing their part, I think this matter will come to an end. We are going to have a temporary measure arrangement and a permanent one. Temporary, as I said, we moved all the patients to nearby hospitals so that they can get services. And the long-term measure, before the end of this week, the department is going to appoint a contractor to come and do maintenance and fix where we are supposed to fix.
Speaking of maintenance, we've also, did our walkabouts and quite observed a number of things, and which also suggests to, lack of maintenance here at the hospital. Is that what you have also noted? Debushing, for an example, besides what is already inside the hospital, is there a challenge as far as maintenance is concerned in this hospital?
You are correct. It's what I have notified here. And then I also told them that they were supposed to detect this incident on time, but they failed. But something under the bridge. What we are going to do now, I'm going to talk to relevant department. The bushing is the responsibility of the police, community safety. And then the maintenance of the entire hospital is our responsibility. As I said earlier, that we are appointing a contract before Saturday, and the chief director and the CEO will come here and introduce that contract, and he or she will start the work. Our observation is that less than 2 months will be done with everything. Even here we can see the ceiling is leaking, the roofing here is old, an old roof. Remember the General Delarey, I'm told he died many years ago, but we are still using the same facility. No renovation, no refreshment, no upgrading of this hospital. But we are here in my program called Urbana Gamatlo. I've seen everything. I'm intervening now, not yesterday.
Does this mean this hospital will be closed for more than 2 months?
It will be closed in terms of sections. Yeah. The chief director is here. From this meeting, I requested her to go and double check which area can be open around next week, which area will be closed for longer. But it will be a temporary closing until the end of this week.
Yeah. Similarly, the case in other hospitals in the province as well. We know this is the third, if not more. There was Lehurutshe Hospital, and yesterday we saw the Moses Kotane Hospital also flooded. What is the status quo in Moses Kotane?
From here, I'm going to Moses Kotane, but the information I got from the management and the spokesperson, everything's in order in Moses Kotane. They have cleaned everything. I'm going there. Even Lehurutshe, everything is in order. The only challenge for now is this General Delarey Hospital. So we are trying our best to fix this hospital. Once this one is fixed, I think the department is safe.
Thank you so much. That is the MEC of the Department of Health in the Northwest Province, Sello Lehari, confirming that some section of this hospital will be closed as they are maintaining this hospital and fixing, the challenge of drainage system here at the General Delarey Hospital. It is the case also in the Moses Kotane Hospital, but we hear the department saying the municipalities have not been doing what they ought to do as far as drainage system is concerned. More than 30 patients, transferred to different hospitals across the province. We understand the maternity ward here at this hospital as well as the Moses Kotane Hospital were also affected.